First at 5, when the Atlanta Medical Center closes in about 2 months, Atlanta will lose not only an emergency room in the heart of the city, but one of our only 2 level 1 trauma centers.
And this is a big deal, and we know how this is going to impact so many of you out there. And tonight we have live team coverage for you. Joe Ripley is looking at the impact this is going to have on hospital workers and patients. But we're going to begin with Joe Hankey, who spoke with the president and CEO of Grady today about the impact this closure could have on emergency care across the city.
Jennifer and Ron, Grady behind me is the only other level 1 trauma center in Atlanta, and standing outside the ER here, I'm about 2 miles from Atlanta Medical Center. Now, when Atlanta Medical Center closes, Grady tells me they should be able to absorb the trauma patients from AMC. The concern, though, is ER wait times citywide.
A lot of that volume that from AMC, 55,000 visits a year, is going to end up in the ER here, the ER at Midtown Emory, the ER at Piedmont Atlanta, and add to already strained capacity in the ERs citywide.
John Haupert is the CEO and president of Grady Health System. He predicts when Atlanta Medical Center closes November 1st, ER wait times will increase, especially for low-level issues. That includes people who think they have the flu or need a blood test, for example. Ideally, they should go to a primary care doctor or urgent care, but often they head to an ER instead.
Particularly those individuals who are uninsured, may not have an option about a primary care practice. But we do in this country in general have a lot of what I would term inappropriate use of emergency departments for doctor visits that really are better off in a primary care office.
In Atlanta, Grady and AMC are the only level 1 trauma centers. According to the American Trauma Society, that means they are looked to as regional resources, capable of providing care for every aspect of a traumatic injury, with 24-hour in-house general surgeons from a wide range of specialties, including emergency medicine and critical care. Outside of Atlanta, Georgia's only other level 1 trauma centers are in Macon, Savannah, and Augusta.
Of course, one less means more intensity for the others. But from what I'm able to assess, there's the capacity to absorb that.
Haupert says thankfully here in Atlanta, Grady is equipped and staffed to take care of its current trauma patients, plus those who have gone to Atlanta Medical Center in the past.
They need to be reassured that this will not disrupt the trauma program, the burn program, the stroke program, the truly emergent services that the community has come to rely on us for.
And when you think of trauma patients, you might usually think of gunshot victims, but I'm told that also includes people that have burns from house fires, injuries from serious car wrecks, traumatic brain injuries, or other serious issues that need immediate higher levels of medical care that only trauma centers usually can offer. Haupert says those are the individuals that thankfully they will still be able to prioritize when AMC closes.